You may indeed. Welcome to everyone. Thank you, Madam Chair. We are delighted that all are here to hear from our special guest tonight, who is known to many of us for the work she does, and she no doubt will recognize the faces of many of you who are here. Veronica Lewis is known throughout the county of Los Angeles in the homeless service and reentry sectors, um, as she directs HOPICS. Many of us know that to be Homeless Outreach Program Integrated Care System, Division of Special Service for Group. She oversees a very large budget seeking to address the multidimensional aspects of homelessness, from mental health to substance use disorder treatment, reentry support, and a range of other things. Um, a woman of faith, a woman of conviction. She leans in, stood shoulder to shoulder with me in the work that we engaged in to bring about Measure H, as were many of you. Uh, but Veronica uh, is a warrior, and she has demonstrated that through thick and thin, the work in which she's engaged is hardly uh, inconsequential, nor is it for the faint of heart. And so we take the opportunity to uh, invite her, to welcome her, to embrace her, to uh, encourage her as she carries on the work of advocacy, service, and activism around those who are yet unhoused. Ladies and gentlemen, Veronica Lewis.
Thank you, Dr. Ridley Thomas, and also thank you, Raya, for the invitation. I do recognize many of the names here, and it's good to be with you all. Can you hear me?
Yes.
Yeah.
Okay. It's good to be with y'all, and I am excited to have a conversation about some of the equity things we've been a part of with Artie. Raya reached out after the case study article came out from Artie, I think a couple of weeks ago, if not last week. And I think in a moment in our country where equity seems to be a bad word, it's even more important to double down on the realities of the long-term disparities and equities, some intentional, some unintentional, but nevertheless, the outcome is the same for Black and Brown folks. And so I'm really excited to talk about the journey we've been on with many of you that are here today, as well as some of the special initiatives and the way that we are trying, as best we can to center equity, and some of the initiatives we've even launched ourselves outside of the public sphere. So am I able to share my screen, Raya?
Yes, you're a co-host.
Okay. All right. Here we go. And excuse my voice. There's some kind of frog in there, but as long as you can hear me, that's fine. All right. There we go. All right. You see my screen good? Okay.
Yes.
All right. So again, this the notion of disparities and inequities is not just what year is this? It's not just 7 years old, but a lot of the work in our county to actually begin to try to do something about what we knew was happening began 8 or so years ago. So, some of the things we should know about where the county is formally, obviously, because I already published the article, and then I'm going to talk about HOPICS for most of this time. But LA County has formally taken a position and a motion within the last couple of years, recognizing that racial disparities is a systemic issue, requires structural change, and there's been several supplemental motions related to that to try to begin to move the needle on some things. And already Anti-Racism, Diversity, and Inclusion, led by Dr. Scorza, is really the driver of, and I think they said they're up to more than 40 motions, so we know what that means, right? But nevertheless, there's all these different motions that Artie is responsible for realizing related to a variety of types of equity, not only racial equity, but also gender equity and some other pieces as well. And the focus is on the key sectors where either there's overrepresentation or um, disparate numbers, obviously related to homelessness, housing, education, economic development, and other things. So the background is, again, it's not new, but I think that some of the data that just show overrepresentation of Black people in particular, uh, and you know, our supervisor was in place at the time who also drove a lot of this, and there was a decision to create an ad hoc committee on Black people experiencing homelessness that had people that were representing multiple sectors, folks from the faith community. There was a wide array of perspectives at the table, and what was born out of some of that, and then also, what led to it, and also continued and expanded, was a deep dive into the data to understand what was happening in terms of enrollments for folks, right? The actual service provision, and ultimately what tells us whether or not people were successful in achieving the outcome of their respective programs was what were the outcomes? What were the exits? Was there a difference between groups looking at whether or not folks were exiting to permanent housing or exiting to whatever the next step in their journey was? And it was overwhelming that there were a lot of disparities for Black people. And when I say disparities in terms of the homeless and housing, I always talk about those three things: access, service provision, and what was the ultimate outcome. And the data showed very clearly that Black residents face significantly higher barriers to permanent housing, accessing it and sustaining it than other groups, and that there was a huge need for more culturally responsive ways to support Black people to improve those outcomes. And so the ad hoc committee on Black people experiencing homelessness was formed. There's several people here that was a part of that. It always was intended to sunset. And from that work that took just shy of a year, there was this groundbreaking report that was created. And I don't think one like it had been done in the nation. And there was over 60 recommendations that covered an array of sectors, factors. Some were short term wins, some were obviously more systemic, long term things that would need to take place. And a lot has transpired since the report was released. But where we find ourselves now, and what kind of that report that you all saw that already released recently was born out of, is it shifted a couple of years ago to an actual implementation phase, where we are trying to actually work with the county departments, figure out who's responsible for what, and move the needle on 20 of those 60 recommendations. All of them are important, but obviously there was lots of complexities. And so our group decided to begin with 20 of those, and they're actively in the implementation phase right now. And so, the most glaring data point of them all is the number, the percentage, depending on point in time, count changes. But essentially, we hover somewhere between 8 to 10% of the population, Black people, excuse me, hover between 8 to 10% of the population, general population, and the number fluctuates somewhere between 31 to 38% represented in the homeless sector. And the only other group that has the overrepresentation is the Native American community. And, I'm not going to go over the root causes. I think you all know what those things are, but on the screen are the core root causes that were identified in the ad hoc committee's report and that continue to be discussed, and that we continue to push to be discussed, rather, at these tables where decisions are being made about resource allocations, et cetera. So, you know, I'm often bringing this up. Any of you who have been in the meeting with me, and there's a longer chart that actually shows like other, more progress being made. But I bring this up all the time because as we are thinking about it, and as you see some of the initiatives that HOPICS has been a part of, I really keep talking about stacking the box. I say books, but these are boxes. But I always talk about stacking the boxes, and certainly the emergency and triage supports that we provide. And I'll share a little bit about that in a minute, are very important to address people living in squalor, to meet immediate health needs. But ultimately, we talk about equity. Obviously, the one-time supports are not going to do that. And so a lot of the things that we've been pushing for and have been at the table to help create or help sustain are things that stack the books under people's feet, which not a lot of public sector funding is designed to do. And so hopefully you'll see some of the things that we're trying to do and demonstrate on a small scale effectively works for sustained change and actually moving from some of the inequities can be taken to scale. But this is the distinction. And we have to stack the books so that folks can get on level ground because there's a recognition. And obviously, you all know equity is an acknowledgement that some groups are more advantaged than others. And that has been at the core of how we've been trying to operate. Sometimes we have constraints, obviously, related to public dollars and all of the restrictions around them. But with our philanthropic partners, we've been able to try things and get creative about how we actually stack the books and demonstrate what it means when you're thoughtful and is equity based versus doing business as usual. So hopefully you can see how we're doing that and become a part of it. So really quickly again, since Ray reached out because of the report, I want to just flag, and I say this all the time because I think it's critically important. Artie initially was created in large part because of the Black People Experiencing Homelessness report. Now, obviously, it has a much broader responsibility to multiple groups, multiple ethnicities. But I want to be clear that one of the driving catalysts for artist creation was because of the request for the county to formally do something. And so we're very excited that we get to work with the department that our initial recommendations helped to create. So a little bit about HOPICS, and then I'll jump into what we're actually doing, right? And the case study didn't share a lot of detail. I hope to shed a little bit more light on all the information that we gave the folks that created that report, so you all understand some of the broad language they use in terms of the ways that we're trying to um, lead with equity front and center at HOPIC. So really quick about us, we're 36 years old, primarily serving Spot 6. Also, in the last couple of years, venturing into expansion into Spot 8, which is right, adjacent to Spot 6. And we focus on three different systems of care. And so we provide support to folks who are returning home from jail or prison, have an array of outpatient mental health and substance use supports for folks. And naturally, our largest portfolio of work is our homeless and housing work. And then our team is more than, the majority of our team is are folks that have some type of lived experience, either precariously housed previously, and unfortunately, sometimes currently, formerly homeless, folks that are in recovery from addiction, folks that were connected to the criminal legal child welfare systems, or current or previous consumers of mental health supports. We have a lot of paraprofessionals, folks that are certified, as well as folks that are degreed and physicians and everything in between. And HOPICS is made up of primarily people of color at every level of the organization, including myself, obviously. Um, and so I just want to show really quickly, and then I'm gonna jump into the equity stuff. This is a report. We had our all team meeting actually just 2 hours ago, and we shared this. So this is a report of what we've done just this fiscal year from July through January. So for the first 7 months, just as a snapshot of the breadth of the work that we've done through both eviction prevention and problem solving or diversion activities, we've helped to prevent 612 households from entering into homelessness, provided over 17,000 supports. I'm not going to read all this. Placed more than 1,400 people in interim housing, and placed more than 720 people, or households rather, into permanent housing. And then I'll skip to the bottom of the page, and I'll share this, Rhea, if your group is interested in seeing it. You all can see some of the basic needs stuff that happens. We are the only navigation center in South LA where folks can come shower, use the restroom with dignity, launder their clothing, etc. And so the navigation center numbers you see, where over 6,000 showers taken, etc. That's for people who are unsheltered, living in their vehicles, etc., who are able to access those services at HOPICS. And then you can see some of the other basic needs stuff. And at the bottom are a couple of, or a few data points from our behavioral health work. And so we've helped to possibly save over 120 lives through overdose reversals because of our administration of Narcan. That doesn't mean our team directly administered, but it could have been Narcan that we gave out to folks who were possibly using right next to somebody else he was using at the same time. So just a quick snapshot of what we've done for the first 7 months of the fiscal year. So, what's our approach, right? As we think about equity, as we think about the fact that we are the community we serve, which is a core principle of who we are. HOPICS was founded, most of you know this, by a brilliant man who found himself on Skid Row and started going to the meetings, as he I used to say, for donuts and coffee, Mike Neely, and realized they didn't know what they were talking about. And came up with a strategy where folks who were homeless or very, very, very recently formerly homeless walk the streets of Skid Row, providing information and resources in a way that people would respond to, right? And as they walk the streets, they discover that many of those folks have been pushed north and were from South Los Angeles, which is why South LA has always been our base. But we are the community we serve is a part of who we are, it's how we started. And even though we've grown and expanded and professionalized in some ways, it's still at the core of who HOPICS is and how we do and center our work. And so, it matters because lots of folks, you hear the stories time and time again where people are being served, not only by people that don't look like them, but just don't understand and or where the implicit biases are coming into play. And so we're very proud of being able to have folks relate to the people that are delivering the supports on the other side of the desk, if you will, or on the other side of the sidewalk, even for the initiatives that are happening in the field. And an integrated way of doing the work, right? Where it's not just homeless and housing supports, but there's mental health supports, economic development supports, etc., as well as a core part of how we do our work is collaboration. Dozens of organizations, not just because we happen to be the coordinated entry system lead, but coordinating with other organizations, figuring out how to have a warm handoff and almost like a collective impact model with other folks who either do similar things that we do or other sectors that provide supports that we are not able to provide is critically important to be able to connect the dots and help people navigate all of these very complicated and convoluted systems of care. So I'm going to talk about three different ways that, three different things that we do as it relates to equity. And so the first is making sure we have a seat at the table, right? Like in some cases we're invited, in other cases we pull up a chair, right? But I think that part of our work to make sure that it's that the programs are designed in a way to really stack the books under people's feet and recognize some of the nuances, in particular of South LA and the marginalized communities, as sitting at the table. So I'm not gonna, I'm gonna go through each of these different things that touch on different aspects locally and statewide. But I think it's core. People think about the services, but that's not all we do. We try to bring all of the experiences that we have and the knowledge we've gained, not only from the participants we serve, but obviously, again, we have a lot of employees who have had to navigate these systems prior to working for us, and some of them are actively trying to still navigate some of them. And so we bring all those things to the table. And certainly, I'm at a lot of these tables, but it's not just me, it's people all over HOPICS that are part of these tables. And so obviously the first one is being a key part of the ad hoc and now the implementation, and now it's even changing to something else, policy committee for Black people experiencing homelessness is one thing. Also, it's not only about addressing people that have already fallen out, but obviously there's a significant need to help mitigate people from falling into homelessness in the first place. And so we've had several employees that previously, and actually we got 3 or 4 that are still sitting on the Homeless Prevention Community Advisory Board by the California Policy Lab. And that group is helping to, and a lot of the folks from our team that have lived experience are sitting on that advisory board. But at this board, they are actively working towards figuring out thoughtful, innovative ways to permit more folks from falling into homelessness, catching them further upstream. And so our team was a part of the group when they were developing the predictive analysis work. So how many of you are aware of the DHS predictive analytics work? I can't see you all, but you can speak up or say something. How many of you know what that is?
I do not.
I don't
Do
mind
not.
awkward silence. I'll sit here till y'all respond. Okay.
I do
Anybody
not
know
know
what
it.
that is?
I don't know. Would like to know though.
Sure. So again, they look at all forms of prevention, but one of the things that we keep talking about is, in particular for marginalized communities, is trying to catch folks further upstreams. And there's certain indicators that um, may tell us that some households eventually may be on the brink or at imminent risk of homelessness. So one of the things that came out of this body that's still very much active that California Policy Lab did the research for is the notion of predictive analytics. And so bringing together information and data from all these different systems, from law enforcement, from child welfare, from some other systems, social services, et cetera. And they did an extensive study to understand the likelihood of people that may have connected to, X number of those systems, right, in a certain period of time that may at some point in their life become at risk for homelessness. And so initially the heavy lift was obviously the data sharing, right, and trying to understand if there's a correlation between people who are connected to these different systems. And what it has resulted in is the Los Angeles County's Department of Health Services has an actual predictive analytics department. And when households that are flagged because of the determination of, what is the indication that a household may become at risk of homelessness, then they actually proactively reaching out to these households to offer resources and information. And so we talk about going all the way upstream, not waiting for the bottom to fall out or the bottom to start cracking. That's one of a variety of things that's happening to try to use the information and data to understand and actually proactively reach out and try to mitigate people from even getting to the point of being at risk. So we're very proud to be a part of that and have been a part of providing input and being a part of the development of the predictive analytics work. The next thing is the state has an interagency council on homelessness, where all these different state departments and secretary agency heads that come together, even Caltrans, anybody that may impact or affect or have programs connected to preventing or ending homelessness is at this table. So it's 18 different departments. And so this body has a racial equity work group that is made up of community members. I happen to be one of them, and state department heads that are looking at the equity-based parts of the action plan for Cal ICH and really trying to develop a strategy to transform policies, practices, how the state departments hold local jurisdictions, including the continuums of care. That's also in the case of LA, the greater LA, and all these other folks that they're granting money to accountable, and how they can shift to address the inequities and disparities that they've long known exist. And so we are to the point where there have been frameworks developed that each of the state departments are going to have to uh, utilize to begin to shift how they're allocating resources, begin to adjust their policies. And again, obviously there's some nuances with the federal administration because naturally the state of California gets money from the federal administration, but there's still a commitment overall for the state from the state to focus on this. It just may have to be a little bit more thoughtful. But nevertheless, we are at the table helping craft and design and ensure that the unique needs of marginalized communities and the things that need to happen to improve their experiences across the state of California and with respect to the departments are being considered. Another effort that we're involved in at HOPICS is you all know there's 3 branches of government, right? There's legislative, there's executive, and there's judicial. That applies at the state level as well. So the Judicial Council sets the policies and practices for the courts across the state of California, and they have multiple advisory committees that help inform what they do. One of those advisory committees is the Collaborative Justice Courts Advisory Committee. So collaborative courts are like your homeless court, mental health court, drug court, all those courts, essentially diversion programs. So instead of being sentenced to jail or prison, you may be mandated or sanctioned to receive treatment or support in the community. It's critically important. It's at risk now in some ways. But we are at this table, right? And so data, you all should not be surprised if you never heard this before. Black and brown folks do not gain access to this alternative to incarceration, if you will, as much as white people do. And that data is not, so that means that more Black and brown folks who may have the same or a similar situation to a white person who walks into the court are being sent to jail or prison, and others are given an opportunity to rehabilitating the community. And so it's been long known that there's disparities and inequities there. And finally, the Judicial Council formally asked this committee to do something about it. And so we helped create a report that's actually going to be presented to the full Judicial Council next month to talk about recommendations for how to hold the collaborative courts accountable for starting to and come up with strategies to try to reduce those disparities, meaning that more Black and brown people have opportunity to go to treatment as opposed to jail and incarceration. And we're at those tables pushing that statewide. And then the other thing that we continue to talk about, because it's critical, we are the community we serve. Our folks come from marginalized communities. A lot of them come from low income households. And so it's unfair that the people that are doing the work are expected to be paid low wages and continue to do the work. In particular, now, when folks that are doing similar things at county and quasi governmental organizations are being paid significantly higher wages. And so we continue to advocate at HOPICS for pay parity, and are proud to say that we contributed to it. I directly contributed to the final language, pay parity language in Measure A, to make sure that it got in there. And obviously now our charge is to make sure that is implemented in the way that is there, but to pay parity with the county and city employees, to be clear, and LAWSA employees is what the parity is related to. And a living wage that builds in cost of living and things like that for people that are doing this work in Los Angeles County. And then the last thing I'll mention in terms of how we're bringing our experiences and our service delivery to these different tables to continue to uplift equity is, how many of you know what Prop 1 is? I know this is the homeless, but it's all related. So how many of you know what Prop 1 is? Anybody?
I do.
Thank you, Raya.
You're welcome.
Nobody else knows what Prop 1 is?
MHSA?
Yes. Prop 1 is shifting the Mental Health Services Act to the Behavioral Health Services Act, and also putting a significant amount of money into creating more housing for a variety of different levels of care for people with mental illness and addiction. And so, part of the transformation, and I know there's lots of feelings about Prop 1 and the shift. I'm not here to say it's good or bad necessarily, but it's here. And part of what's supposed to happen in the transformation is to address those same three things that I talked about in the homeless services bill, right? To address some of the inequities and the challenges of marginalized communities related to access, the service provision, and the exits and the outcomes. And so HOPICS has been actively a part of this process, and we have 2 slots on what will formally be the Behavioral Services Act community planning team that helps craft the adjusted policy that LA County, being led by DMH right now, and SAPC, the Department of Public Health, will ultimately propose in terms of this shift. So, and it's relevant to homelessness and housing for the reasons I just said. So that's a variety of ways that we are bringing our experiences and our program expertise and the lived experiences and everything else to all these different tables. And there's more, but this is just, I think, enough for you all to get the get the point that beyond the work that we're doing, we also are at the table pushing in a lot of different ways across all the different systems that impact people being our house. So I'm gonna pause there before I move on, because that was a lot of information. You all are quiet, but that's okay. Any questions or comments so far before I move on to the next slide?
Jolly?
Peter, thank you for taking my comment. I would say that the reason why I don't know a lot about what you're talking about is because a lot of that information I'm not privy to get that, I guess because of being a Black, and sometimes you don't always get a lot of information in terms of resources. But I'm thankful that you're sharing this information. So if you don't get a bunch of your questions, this and I appreciate it. Thank you very much.
Thank you. No pressure, but I am as supervisor said, I'm a minister's wife, so call and response is in me, so it's okay. I'm not offended. Folks don't say anything, but call and response is a natural part of how I engage with folks. There, I don't know why it's showing my hand is up red, but any other comments or questions before I keep going?
I have a question. My name is Andrea, and the information you shared has been very powerful and very helpful. It also synthesizes a lot of the bills we voted on, or propositions, I'm sorry, that we voted on already, to see where they're actually being implemented. So I think that's helpful to just witness that. I would like to have the address of the HOPICS location where they can actually go and take baths and showers. Because I'm with Aaron Community Cultural Center. We have multiple food giveaway programs on Tuesday, and many times individuals will come and they're looking for a place where they can actually go and get the assistance that you're offering at HOPICS. So it would be good to have that as a resource. Also, we will get a lot of calls from 211 for individuals looking for those resources. So it would be very helpful to have that. Thank
Okay,
you very much.
I can give it to you now, and I'll send you the SPA 6 Access and NAF Center list, and it doesn't just
Okay.
stop. It has everywhere that people can go depending on the population. But the address is 729 West Manchester Avenue. It's right off of Manchester and Hoover. But I'll send it so you all can see where people can access services. Again, it's not unique to HOPICS. It has everybody, all the access points on there, including the NAV Center. I'll share that.
Okay, thank you. You're gonna put that up on the screen now?
No, I'm
Oh,
gonna keep
okay.
going with the presentation. But
Okay, I see. You're gonna give it to Rhea and she can send it out to us. All right.
Yes,
Thank you.
I added to the slide deck so that it's all in one place, and you all can just open the slide deck and see all the information, probably at the back of it. Does that work? Okay.
Yes, ma'am.
That works.
Appreciate it.
Okay. Thank you.
Thank you.
All right, I'm gonna keep going. So, we do a lot of different things, but I think that the things that are really centered in equity, trying to create opportunities for folks, right? Trying to help people navigate the systems, trying to provide information and resources that people would otherwise not have access to, which is one of the core parts of the work, right? And actual resources, financial resources for folks. To get to the other side is what I mean, and why these things are listed as equity-based programs. And so the multidisciplinary outreach teams in SPA 6, some people call them E6 still, and it's an old reference to initially when Measure H came to be in the alphabet numeric soup that came to be. But the street-based engagement teams that are made up of all these different specialties, nurses, mental health therapists, substance use counselors, people that were formerly homeless or themselves, case managers, etc., are literally taking supports to folks every single day, 7 days a week. In SPA 6, we have HOPICS has 21 teams. Some of them are actually on the metro train stations. Other folks are at public spaces. And some are just, going to different neighborhoods multiple times, but building a rapport with folks, ultimately trying to stop people from dying while they're living outside, doing whatever it takes to ultimately help them come inside, is one of the things that we're doing. And then, HOPICS provides an array of comprehensive substance use supports, all the way from a lot of harm reduction work in over 40 encampments in SPA 6, all the way and treatment, all the way up to abstinence-based recovery bridge housing. And so the full continuum of services for folks, including being the SPA 6 hub for navigating people to the appropriate levels of care who are trying to access addiction support. And then we're one of the South LA Trauma Recovery Centers. And we've been doing this now for over 12 years. And the Trauma Recovery Center is a model that was really created almost 20 years ago by the University of California in San Francisco. And essentially almost 10 years ago, legislation came up and they refunded it. And most trauma recovery centers are in hospitals because essentially if somebody comes in and they've been a victim of violent crime, that'll be a flag that they may need, or a derivative family member of someone who may have been murdered. That'll be a flag. But we were the first community-based trauma recovery center because we were able to demonstrate, unfortunately, the large incidence of community violence in South LA. And obviously that combined with the folks that are unhoused that we serve, we were the first, and there's a few others now, but we were the first community-based trauma recovery center that the state of California funded. And so an array of supports, culturally responsive, expressive arts, not just traditional talk therapy, but an array of supports to help people pick up the pieces and actually understand their rights as victims. And I know we're on both ends, right? We serve a lot of different populations, but is a core part in terms of people being able to heal and being able to know how to access and navigate. And then we have a robust integrated health initiative at our interim housing sites. So on any given night, HOPICS is keeping about 1,500 people off the street, including 300 to 400 children. And we have actual physicians coming to our interim housing sites now, providing supports for all ages, adults and children alike, that we're continuing to try to expand on and show that this model works. There's no public funding for this effort. We have partnered with private physicians and gotten some foundation money to do this, but we're trying to demonstrate what having actual physicians come on site regularly does, and actually having medication delivered to the interim housing sites, and just all the things you can think of to try to mitigate some of the challenges with accessing the healthcare system at our interim housing sites. And so we are actively piloting it, if you will, and planning to present what it costs, what it takes, what it looks like to try to expand that model. There's lots of other models in LA County, largely related to nurses coming, which obviously nurses can do a lot of things, but being able to prescribe and have medicine delivered and all these other things, we're actively doing it at a few of our interim housing sites, and there's been a lot of successful health outcomes because of that, or improved health outcomes because of that. And then also a pretty robust street medicine effort as well, right? That includes medically assisted treatment. It includes people, physicians actually coming to encampments multiple times a week, and physicians being on call when our outreach teams call them, being able to come out in many cases when we call them if there's an emergency. And so continue to just try to serve the whole person, and again, remove the barriers and improve health outcomes for folks who are unhoused and housed. And there's a significant amount of encampment-based efforts where we've moved in the last 2 years. This is a real number, over 700 people from encampments into some form of housing, either into interim housing or directly into permanent housing. And continue to be a part of the city, county, and state efforts related to that. And then a significant amount of supports for folks who are recently returning home from incarceration, or as we know, even if people have been home for years, there's still housing and employment discrimination. And so even people that have been in the community for years now, but are still facing challenges, providing an array of supports to them. And then some of the special initiatives that we've created or co-created at HOPICS, one of the data points during the early data analysis when the ad hoc committee on Black people experiencing homelessness first started was glaring, that the rate at which Black people who had been connected to permanent supportive housing, permanently housed, were falling out of permanent supportive housing in comparison to other groups was very concerning. And so in partnership with research partners, we piloted a couple of different strategies to try to better engage. In particular, in this case, it was older Black adults that had been placed in the PSH to try to mitigate them from falling out. And this is one of many other things that other folks have done. And then as a result of that, we're continuing to increase the number of permanent supportive housing sites that we're the supportive services provider at, so that we can bring those culturally responsive supports to the people that have recently moved into all these projects that are popping up in South LA.
Right.
Okay. And then economic stability and class supportive services. So economic stability is housing stability, and it just is. And so besides some specialized programs where we're doing employment supports, we have one of the city-funded workforce centers has been co-located with HOPICS for the last 10 years. And so that means that folks that we're serving get access directly to all of the resources that come along with the workforce development programs. And we obviously, there's strong collaboration because they're co-located at our largest location. And then one of the things I'm most excited about that is literally the example of equity-based programming. I was in Washington, D.C. about 3 years ago, and I got a chance to sit with some of the folks in DC, and they were talking about this program they were working on that where the housing assistance was tied to employment and people increasing their income. And so at the local level, HOPICS, Sanctuary of Hope, CRCD, WLCAC, and Shields for Families, we have been tapped by the Deutsche Foundation, maybe, 4 years ago, to come up with the initiative for South LA for homeless families connected to employment. And so when I came back from DC, we were in the stages of finalizing it, and we came up with now what is known as Helping Families Thrive. And essentially, it's families that are connected already to some type of time limited rapid housing resource. And what it does is there's a strong economic mobility coach and piece of it. And if their public assistance ends, we continue to pay their rent, so they don't have to worry about that. And the goal is to get them to the point where wherever they have to do, whether it's vocational training, apprenticeships, internships, other activities that people that are low income usually don't have the opportunity to even think about doing because they're trying to make ends meet and survive. But whatever their economic mobility, and including entrepreneurship activities as well, whatever their economic mobility strategy is to get them to the other side to be able to be economically stable and housing stable, we support that. And the housing assistance ends at the end of that. But we've created a pathway for them to focus solely on their economic mobility. And so we're in the first year of it. Again, there's all the partners. We're really excited about it because this is one of those things we want to try to demonstrate. This is an equity based program that intends to move the needle and create opportunities for people that they didn't have. So we just finished our first year and look forward to sharing more of the outcomes related to that. And then a couple of other things. Again, I can't leave our employees out, right? Because our employees, we're the community we serve. And so the thing I'll highlight is we're about to stand up a HOPICS employee equity fund for our own employees with some private resources where they'll get a significant chunk of money and a financial coach for 12 months to get them to the other side and support their economic mobility as well. And then the last thing I'll say, we've allowed for our employees to contribute based on their experiences. And so we've done one impact tank so far, which essentially is like Shark Tank, where they were able to come in, present ideas to fill gaps that they saw, either amongst our staff or with the programs we provide. And happy to say we were able to fund 2 of those programs. One of them is to train our employees and teach them about permanent supportive housing as a part of the effort to try to increase the number of permanent supportive housing developers. And the other one is a chaplaincy program for SPOSIX participants and employees. So that's it. I know that was a lot. I see a hand up, but yeah, those are the things that we're doing. And yeah.
Veronica, thank you. I mean, talk about educate, engage, and empower. I am continually grateful for and inspired by all that you do. And just the leadership you show in our community and with HOPICS. Thank you. I know we have some questions. May we open it out for a little bit of Q&A?
Yes. Sorry.
All right. Jolly?
Thank you so much for that presentation. That was very helpful. I would also like to know if you're open to any collaborative partners that happen to be CBOs that work in the workforce development or pre-employment training sort of areas, just by chance.
Yeah, absolutely. As I said, one of the work centers has been located with us for 10 years, and we are slowly but surely standing up our own economic mobility staffing. So yes, economic mobility is housing stability. So we are trying to connect to as many resources as possible to help people increase their income and increase their skills, etc. So absolutely. Yeah, I'll put my
Okay,
email
wonderful.
address in the chat.
Okay, I'll look for it. Thank you so much.
Thank you.
Mhm.
Thank you, Jolly. Any other questions for Veronica?
Yeah, can you hear me? My name is Star Salter.
Yes, Star, we can hear you. Go ahead.
Fantastic. I'm currently being evicted. I came on this line because this came across my email page, my Yahoo account, and I'm not being evicted for for non-payment of rent. It's just personality conflict between an elderly lady and me, and then come to find out, I called LA Department of Building and Safety that the upper unit that I'm living in is an illegal ADU. And from that, she retaliated by filing a summons against me. In it, she says no longer wants me as a tenant, which is not part of the just cause or no fault eviction. But I mention all that to state that I had went to Sage SAJE, and I don't think I went to State House LA. um, EDN, Eviction Defense Network, with the Atlanta Pope that wants you to buy the $33 notebook. I bought it. Um, Only thing I receive is counseling. For is HOPICS, for is what do I do or where do I go after eviction? I'm looking for housing right now. I'm on Social Security, and I am a senior citizen. I don't feel like one, but anyway, I'm a senior citizen. The 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 solution is not there in these organizations that say they will help you through your unlawful detainer. And I only mention this is because when I showed up, I was the last one to be counseled,
Mm-hmm.
and I'm not there for non-payment of rent. I've been here 7 years, paid the rent
Mm-hmm.
on time each month, and since I found out, and LA Department of Building and Safety served them with an order to comply. They
Mm-hmm.
ripped out the kitchen sink, so I no longer have a kitchen sink. LA Housing Department tells me, "Oh, they're trying to get you to self evict," which we went to the court, and now I have 60 days, actually 7 more weeks.
So,
Um,
Star, may I ask, would you like support with services?
I would like support with services. I would
Okay.
love services, but I mention all this is that I didn't hear her say any interactions with these organizations that call you in and say, "Oh, go to State House LA. They'll help you with your eviction process or get the documents done." When I was at EDN,
Uh-huh.
I didn't hear EDN or see it, and I may have overlooked it because I didn't understand it. Yeah, I may have, because I'm stressed out through my process. But in EDN, I didn't hear
Mm-hmm.
any. I didn't see. I was not given a list of these are other resources.
Mm-hmm.
Go to court.
So,
I'm not
Star, I think
that's me.
different agencies function a little differently and have different aspects of services that they're able to provide. So, what I'm going to do, Star, is I am going to put my Empowerment Congress email in the chat, and I'm going to ask you to email me after the meeting so that we can better support with directing you towards services and with your needs. Okay?
Yeah, I understand that for me, but generally in the
Thank you.
overall perspective, I don't think people who are going to, because I'm sorry, I'm trying to stay consistent with what I'm saying.
That's
I
okay.
People who are going through the eviction process,
Mm-hmm.
not they end up being homeless because they don't know where to turn to
Sure.
afterwards, after the judge give them a 5 day or 60 day notice to leave the premises.
Mm-hmm.
And
So, and I think, Star, that this also addresses a lot of what Veronica was sharing. In Los Angeles County is a really big county, and Veronica was sharing a lot of the amazing initiatives and work that HOPICS does and the people that HOPICS has been able to reach. I mean, Veronica, for LA County is 88 cities deep, and you all are doing so much amazing work in SPA 6. Maybe one of the questions would we be able to address as we think about the equity initiatives, the anti-racism initiatives, and everything that's been happening in the county and city. It's taken a long time to be able to actualize some of these solutions. So would you mind sharing with us just, some of we get to hear and see all of the successes. What are some of the barriers and obstacles as a service provider that you have had to overcome to be able to ensure that you're able to continue these services and expand the service delivery so that it continues to bolster equity?
Yeah, I mean, I'll respond to that, but also I just want to be clear, there are gaps,
Sure.
right? So prevention is there's gaps, and so there's the organizational stuff that needs to be fixed, right? Which I'm working on daily, but then there's also system requirements and program designs that are flawed that we have to be responsive to, otherwise we got to pay back thousands of dollars, right? So there's all that, but I will acknowledge that the need to have robust supports for a variety of different reasons that lead people to being at risk of becoming homeless. We just don't have it at the level that we should. The good news is Measure A significantly invests a lot more money in prevention. And I think that, while it doesn't resolve what Star was saying right now, and I have some thoughts. She said stay house that late. That's what I was going to suggest, right? But, so I heard a bad experience with that. But this is the time for folks that want to weigh in about the gaps, right? Or your specific scenarios that you've either experienced or folks you know have experienced that need to be a part of these program designs. All the conversations about Measure A are happening at all these different tables. I'm not even going to try to list all the acronyms because I don't even know them all by heart right now about how to use the money, how to implement it. But prevention is one of the biggest pieces because the chunk of money is huge. It's not only for rental arrears and things like that.
Mm-hmm.
There's a huge right to counsel component that's being created to expand the legal supports. But I think, the gap in terms of if you don't already have the 3-day notice or the unlawful detainer and are not basically like 5 days away or some other kind of extenuating circumstance, there's not really a lot of supports currently. And I think that this is the opportunity for folks to show up to those spaces and make sure that the considerations for scenarios that have not been a part of the eligibility of previous prevention programs, it's time for people to speak up and say those things. Now, with that said, I can't speak to Star's specific experience. I can say that the eligibility requirements are very narrow, unfortunately, for who can access prevention, and that may be what you're experiencing. And that applies to any organization that has eviction prevention supports, HOPICS or otherwise. But this is the time because all those decisions are being made right now.
Sure.
About what it'll look like come July.
Thank you, Veronica.
Madam Chair, I think it's a useful thing to take this example, this concrete illustration,
Sure.
and in the context of the working group, advance a letter to Measure A steering committees and make sure that our advocacy locates itself in terms of this aspect of prevention. Veronica makes the point that Measure A held out the hope and in some ways the promise to improve the status quo with respect to homelessness.
Mm-hmm.
Now, it seems to me that this is a fundamental issue. And one of the ways in which they held that hope out is by saying that there would be resources that would be in perpetuity, that there is no sunset. And so, in terms of the discussion about equity, this is a pretty fundamental systemic matter. And
Mm-hmm.
so, the right to counsel has to be elevated and connected sharply with the service provision. So, I would hope that we could advance an appropriate communication reflective of the conversation we've had at the individual and at the systemic level. Thank you, Madam Chair.
Absolutely. Thank you, Supervisor. Thank you. Reba?
Sorry, I don't know if Amika can't raise her hand, but she put in the chat that she wanted to say something, so I just want to acknowledge that.
Oh,
Uh,
thank you. Okay, should we do Reba, then Mika, then MC?
yeah, as long as it's not MC Hammer, we can handle it. Let's keep pushing. Yeah.
All right, thank you. Miss Reba, and then Mika, and then MC. Go for it, Reba.
Let me first thank you, Veronica Lewis. It's interesting because it's as soon as I think I know HOPICS, I realize I don't know HOPICS. There's so much more to learn. And I want to compliment you for helping the people that are helping the people. So when I think about equity, that is what equity looks like in the workspace. When you can recognize the need to ensure that they are on solid ground and serving the people that they are serving. It just warms my heart. So I'm throwing you hugs and kisses right now, and I greatly appreciate it. The other is that you had mentioned something I was hoping that you would have went just a little further, and that is around the CPT meetings and getting involved and getting engaged. So I'm thinking that it would also be helpful to share with Rhea, to share with others about all of these meetings and where to show up and when to show up. And I'll also support in that effort. So thank you again so very much for the great work that you're doing.
Thank you, Reba.
Thank you, Reba. And we'd be happy to share. Mika?
Again, everyone, and again, thank you so much for this platform. For over a year, I've been aggressively, and my whole family can tell you, looking for platforms like this to where I can learn how to better serve the people. I am very solution-based, to the point, to my own demise, and sometimes where I overwork myself. But what I do want to speak to is young lady that was talking when I came on. I want to offer my services to her free of charge. I will help you because I know exactly what you're dealing with. I was on the front lines at the courts watching our seniors be instantly, almost the same day that they would appear for court, being going into default and having only so many days to move out, losing their cases because they did not know how to navigate the system. And in some cases, they were dealing with greedy landlords. They weren't late on rent. It wasn't a rent issue. And a number of our seniors got displaced. And what I want to say is I've also volunteered for over a year with some of those agencies that we navigate our community to. Stay Housed LA is informational. If you don't live in a particular zip code, you just have to go online and watch a webinar. And then Eviction Defense, if I may speak on this, Eviction Defense Network is the catch-all. If you don't fall into those specific zip codes, then you go to Eviction Defense, and that becomes your legal service provider. And they do have a process. And I've been silent for a long time, but I guess now I'm supposed to say something, but they have a problem with how they service Black people.
Mm-hmm.
I I volunteered for them and then I worked for them for just a quick amount of time, and the integrity made me leave. I couldn't deal with seeing people that look like me crying because they sat in the office all day and wasn't served, or they had an open and shut case that could have been won by one of the attorneys and they were told, well, you can't win because of your color. These are things that I heard, that I witnessed. I've also witnessed sending tenants to some of these other partner agencies to get housing, and they were turned away. And I would have to come with them, put on a smiling face and beg, basically saying, hey, this tenant is assigned to you. But when the tenant went alone, they would say, well, we can't help you unless they got an advocate to come with them. with a smiling face, and then they would service them. So there is some systemic issue
Yep.
that
And Mika,
Black,
that's a
I'm
lot of
not,
what is addressed in the report that Veronica and her team contributed to as well. And unfortunately, these are barriers that we are continuing to navigate and develop solutions to so that they don't exist.
right.
Thank you for offering your support to Star, though. If there's
Oh
anything we
yeah,
can do
absolutely.
to support connecting you both.
Absolutely. I put my information in the chat,
Sure.
and I don't want this to become me complaining or pointing my finger at anyone, any agency. All of these agencies do feel a need, including
Mm-hmm.
Defense Network. They really can prepare a tenant to appear before a judge in the right
Sure.
culture, in the right posture. But
Mm-hmm.
they are lacking in an area that can keep our people off the street. When I say our people, I mean all Angelinos
Sure.
deserve to be housed.
Yeah.
So I'm saying if there is any way that I can help, if you
Mm-hmm.
guys need navigators to go with people and, you know, hold their hand, especially our seniors.
Mm-hmm.
I can't tell you how heartbreaking it is to know that you can't help them because
And I think
it's
that
coming back against them.
that speaks to how heartbreaking it is to know that any one of our fellow Angelinos is experiencing homelessness or at risk of being unhoused. So
Right.
thank you,
So even
Mika.
if
I
we can
wanna
get some numbers of who we can call,
sure.
that would be great too at some of the agencies like LAHD, because some of these
Okay.
tenants are also living in really bad conditions
Sure.
and it's overlooked. I'm sorry
Thank you,
for
Mika.
going. Thank you.
Thank you. I think we have time for one last question. Veronica, is that okay with you? All
Yeah.
right. Thank you. Mr. Harris, what is your question,
I
please?
thought MC was next.
I thought so, but MC, I saw your hand go up and then down. So did you still have a question, MC? And then we'll close it out with Vincent's question.
Yeah, I just had a comment as
Sure.
well to the Star's case. Uh the problem I've noticed is that because I have also been in the eviction process myself and also not for non-payment for other things.
Mm-hmm.
But the thing is that what they did was the Stanley Moss court, what they wound up doing is that they took the attorney privileges away from the poor and they gave it to specific area codes. That was the problem. It was fine when it was running for people who were not able to afford attorneys. The process was so smooth. It was completely smooth. It worked. But when they changed that process up with Stay House LA and made it about the area codes, it completely wrecked that whole system. And it really placed a lot of the burden on the tenant to have to do and stand up for themselves in court and not have representation. So that was all I really wanted to say, that it really, really discombobulated everything when I don't know if it's the state who took over or the county or whoever who took over that program, they completely disrupted it. It was actually working perfectly, but it just got completely wrecked.
Thank you for sharing that, MC. Thank you for your feedback. Mr. Harris?
Thank you, Rhea. I actually put the question that I had in the chat, and it's to Veronica. In addition to what Dr. Ridley Thomas mentioned about us following up with a correspondence,
Mm-hmm.
I guess the question in my mind is, what is the single thing Empowerment Congress homelessness working group members could do to advance equity in LA County with regard to homelessness? That's to
Yeah.
Veronica. In your, in your opinion, because I think we're always looking for ways to
Mm-hmm.
engage and to try to influence the policy.
Yeah, great question. And I think this is a perfect time because again, all that there's equity requirements built into Measure A, right? Because Measure A formally takes effect April 1, right? But will be the predominant source of resources for homeless and housing services in Los Angeles County as of July 1st. And there's equity principles built in related to the service provision, right? The policies, contracting, and then the contracting piece also related to the salary parity. And I think that this is the time. So all these spaces, and again, I think where you have the information, and if not, I can collaborate with you to get it. But
Sure.
where the decisions are being made, showing up to make sure that our county board of supervisors, the homeless deputies, these other groups with the electeds now, all around the table, know that they're going to be held accountable and that the community is watching and demanding that they hold true to all of the things that they said they would do as it relates to the equity piece and the prevention piece, which is a huge issue, especially with the economic landscape getting worse and worse for folks. I think that's what this group and you all in your individual networks can do right now. Show up and let them know you know what the language says and that you expect it to be implemented in a way that honors the intent of how they got people to vote yes on Measure A. That's my thought.
Got it. Thank you.
Thank you. Thank you for that question, Mr. Harris, and thank you so much, Veronica, just for all that you continue to do and for sharing your time and space with us this evening. If there's anything that we as the Empowerment Congress can also do to support all your endeavors at HOPICS, please let us know.
Madam Chair, I think it's appropriate to once again thank Veronica Lewis for sharing with us tonight. I said at the top, this is not for the faint of heart. This is a challenge of gargantuan proportions, and we need to see that for what it is and make us claim about the systemic nature of the problems that we are contending with when we talk about homelessness. Is precisely the point at which we have to speak the language of equity.
Yeah.
So when we talk about government reform in the context of the county of Los Angeles, I'm not sure that homelessness factors into the work plan of that sector of activity. It wouldn't be particularly prominent as such, but I want to offer this consideration to the homelessness working group of the Empowerment Congress. Let's raise it. If there's to be reform of government, the whole notion is to try to make it better.
Yeah.
I don't know what better index of government improvement and the efficacy of service provision can be absent altering the landscape with respect to the homeless crisis in the county of Los Angeles. So if it reduces itself to an abstraction rather than concrete movement on the question that makes the safety net weaker in the county of Los Angeles, then I would hasten to assert that they've missed the mark. We will have missed the mark. So let us then lift our voices in this moment to press the case, not from an accusatory vantage point, but from the perspective of conviction around the crisis that has enveloped this county and is not getting easier. I'm just trying to say something here. It would mean that our voices matter. If we educate, engage, and empower, we just need to be on this. I refuse to retreat and or relent in this connection. And that's what some of us feel led or called to do. It is purpose driven. And Madam Chair, I want to thank you for leaning in and leading this conversation. and chairing the working group itself.
Thank you, Supervisor. It is my privilege and pleasure. And when we have awesome presenters like Veronica, it makes it that much more fun. So, and
Yeah,
thank you for your vision on the Empowerment Congress. So,
indeed.
well, Veronica, we want to thank you again so much just for everything you continue to do. Like I said, I'm always continually grateful for and inspired by you. Thanks for sharing your time with us this evening. I often wonder, I don't know how you have time to do it all, but I'm so thankful that you do. So,
Thank you so much for the invitation.
of course.
And thank you all for your questions and comments.
Thank you. With that, we are going to prepare to close out this evening's meeting. I do want to share one thing, though. As Veronica shared, it's really important to stay informed on all things that are going on. And with the Empowerment Congress, we have been saying if Vincent Mr. Harris says it best, but do something. And if you can do something, we'll try to do more as well with everything going on. So we'd encourage everyone to sign up either for a newsletter of your favorite nonprofit, maybe an organization like HOPICS, to stay informed with all that they are doing, maybe with your local electeds, and also maybe with one of my favorite publications, Praxis, that shares on all things homelessness from the city level, the county level, the state level, and the national level. So we'll hope you will empower us by engaging with us on those fronts. And our next meeting will be Thursday, March 27th. And we look forward to having you join us then. So thank you all.
Thank you.
Thank you. Bye.
Thank you.
Thank
Good night.
you. Good night.
Good night.
Thank you. Good